Hi, this is Dr. Greg Oliver, and hello again from Fat Doctor TV. Well, I hope you're getting some good information out of our episodes here, and if not, send us an email or send us a comment and tell us what you're interested in. But we'll continue to move along. Today we're going to talk about sweeteners. This is a big topic out there, and there's lots of opinions. If you look on the internet, you'll see all kinds of things. But I'm here to kind of hopefully set the record straight on sweeteners today. Now, of course, we all know that the number one sweetener is sugar, but it is a caloric sweetener. It has nutritive value, which means there are calories in it. Yeah, does it taste good? Sure, but we all want to cut back on the sugar. And then there's corn syrup or high fructose corn syrup, which basically is the same thing as our sugar, and that's put in a lot of different things, and we think it may have a lot to do with how our bodies gain a lot of fat. So we want to stay away from that also. So let's talk about the other sweeteners, the one that don't give us calories. And there are two types of those. One are called non-nutritive sweeteners, and those are the ones that show up in most of the diet type drinks and diet type foods that we have. Low-calorie sweeteners or non-nutritive sweeteners would include things like saccharin, and the brand name there that most people know are Sweet and Low. The next one would be aspartame, and again, NutraSweet is the brand name that most of us are familiar with. Acesulfame potassium, that one tends to show up in a lot of treats and a lot of sweet foods and diet foods. Sucralose, or Splenda as we know it, and that one's used a lot for cooking, another non-nutritive. There's a very powerful one called neotame, but don't see it a whole lot out on the market. And then the newest one, which is Ribiana. Ribiana comes from the stevia plant, and the new brand name is called Truvia. So everyone's familiar with those. Those are called non-nutritive. They have very little caloric value, if any, and are put in a lot of things from soft drinks to sugar-free candy, sugar-free treats, dietary foods, low-calorie protein snacks and protein bars, things like that. Then there are the sugar alcohols, and these are again non-nutritive, but they're called sugar alcohols. That's a second type. That includes things like sorbitol, mannitol, xylitol, isomalt, lactitol, and maltitol. A lot of words out there, but if you see those in the labels, then you know you have sugar alcohols. During the great Atkins craze of about 10 years ago, these were put in a lot of the low-carb products. They're sweet, but we don't absorb them. They're sugar alcohols. They're not like ethanol, which will make us drunk, or methanol, which can kill us, but these are not absorbed in the intestinal tract. So they make the foods taste sweet, but they're not absorbed. Because they're not absorbed, a lot of people don't tolerate them very well and can get some cramping, pain, bloating, diarrhea. So that was a common problem with a lot of those foods. You don't see them as much on the market these days, but many companies will use small amounts of those, so check your labels. So here's the big question. Are these things dangerous for us? Now, we hear over the years that saccharin caused cancer, that NutraSweet caused seizures and brain tumors and things like that. There have been lots of studies, and it's not been shown that this is the case. In animals such as rats, there were some problems, but again, those rats were fed pretty significant doses, much higher than any human would ever eat or utilize. So to this date, there is no specific, documentable, proven evidence that any of these are dangerous or toxic to us. Now, I'm kind of a natural person myself. I would prefer to use natural products in place of scientifically formulated products if we can. And so the newest one, which is Ribiana or Truvia from the stevia plant, is probably the most natural of all those. In fact, it'll also be the most expensive. However, we talk about expensive compared to what? Your health? Well, don't worry about the money. Get the best product there. But all of them do work, and I've had products with all of those in them, and from time to time use these products in my dietary regimen. There's also some growing concerns out there that using these low calories or no calories, high sweetened foods can actually increase the risk of obesity and diabetes. And people say, well, how would that happen? There's no calories in them. Our bodies are very complex. And what we may be finding out is that by using these low-calorie or no-calorie sweeteners, we actually increase some of the hormonal and peptide and protein responses in our body. So when the brain senses something sweet through our tongue and it goes into our digestive tract and it senses that sweetness, we increase certain things. And you don't have to remember these. These may be way out there where you don't want to remember it, but incretins and GLP-1, which the bottom line is what these things do when they're increased is they increase our glucose absorption. So our natural glucose or glucose from other foods, our absorption goes way up, which increases the amount of fuel we have and can convert into fat. So that is the current concern, is that just because there's no calories doesn't mean it still doesn't stimulate the fat production process, and some studies have shown that it may increase diabetes. So advice, here's the point of today's process. Number one, these don't appear to be dangerous in modest amounts, so don't worry about that. Number two, these should be used in moderation. In moderation, and alongside of diet and exercise and behavior modification and working with your doctor or your health coach or the provider who's working with you to try and get you to a healthy weight and keep the weight off. So moderation is always the key. And again, if you're concerned about certain products and chemicals, consider the more natural ones. I personally don't have any problem with any of them. But again, moderation is the key, because it still looks like these may have an effect on increasing the rate of obesity or making us want to eat more things, such as binge eating when we have a lot of the sweet foods that don't have any calories. So hopefully that kind of answers some of your questions about the sweeteners out there. And send us a line if you have any other questions, but always excited to see you. And as I always say, hope to see less of you next time on Fat Doctor TV. Dr. Greg Oliver saying so long for now. Have a wonderful week.